So hi everyone, my name is Katie Sanders. I'm a third-year doctoral student at the University of Georgia, and I'd like to extend a special thanks to my co-authors, Nekeisha, Randall, Dr. Alexa Lamm, and Dr. Kevan Lamm. So what I'm going to talk about today is utilizing a framework developed by Dr. Boron and Dr. Kevan Lamm called the CDSI Toolkit, and how we can utilize this community capitals framework to evaluate a community-based intervention. So community change based on shared knowledge can help us provide more holistic transformations with community-engaged work. While Extension has a very unique position to identify needs in rural communities based on these local contexts, Extension has a need for more tools and methods to be able to effectively utilize community strengths and resources to spiral up change. There's also a need to evaluate social capital and decision-making needs within rural communities to, again, transform this change. And community involvement and feedback is very critical for the sustainability of change over the long term, especially once project funding and project interventions have left. So the CDSI Toolkit, which is the Community Diagnostics and Social Impact Toolkit, was developed by Dr. Boron and Dr. Kevan Lamm, and she'll be presenting on this a bit more later. But it is developed out of both the Community Capitals Framework by Emery and Flora, as well as the Culture-Centered Approach by Dutta. And it captures two perspectives, that perceptions of the community and perceived personal ability within the community. The Culture-Centered Approach is kind of the overarching worldview guiding this toolkit, and it's concerned with knowledge production, perceived access to resources, and perceived personal ability or agency within a community. The intent of the culture-centered approach to research and health communication is to deconstruct infrastructure challenges, understand local barriers within the community, and highlight and enhance the voice of community members who are actually affected by change on the ground. The Community Capitals Framework is the more analytical mode and the operationalized mode for the CDSI Toolkit. And it's an analytical tool for organizing and evaluating information about community resources, also known as capital. So capital here is defined by Flora as any type of resource capable of producing additional resources. So when capitals are invested, or these resources are invested, that's when they become capital. The Community Capitals Framework takes a systems perspective to transformation and change, and it looks at the interaction among these capitals in the community and their associated resulting impacts. There's also a focus on agency, and in my work, I think of agency not only as the ability to provide solutions to your own problems, but also the ability to define your own problems and have voice in that. So I'm maybe doing some rapid fire. Okay, so these are the human capitals within the Community Capitals Framework. There are two sets of capitals, human and material. So human capitals are those people's natural and learned competencies, access to necessary resources. Social capital are the connections among people and organizations. Cultural capital is how people understand and interact with the world around them. And political is access to personal and structured power. Then we have the material capitals. Natural, which is the environmental assets that abide in a specific location. Financial or monetary support. And built, which refers to physical infrastructure. Within the CDSI Toolkit, the built financial aspects are actually combined into one construct, and I'll be referring to those as a combined construct moving forward. So that's some background on the theoretical and analytical frameworks. I wanted to apply the CDSI Toolkit on some work that I've been able to conduct as part of the evaluation team on a CDC project called Healthier Together Georgia. It's a partnership between the CDC, the University of Georgia's Cooperative Extension, College of Public Health, and College of Agricultural and Environmental Sciences. And the purpose is to enhance chronic disease prevention through increased food access and physical activity opportunities in 5 rural counties in Georgia. The one I'll be talking about today is a case study of one of these counties, the pseudonym Lambert County. And the role of the CDSI Toolkit here is to provide support for community assessment of existing resources and community needs as a baseline to measure our progress in the initiative moving forward. So the purpose today was a mixed method study to describe the community capitals present in Lambert County, Georgia, through the CDSI and CCF, or Community Capitals Framework, to determine the extent to which HTL, or Healthier Together Lambert, influenced capital development in the community. The first research question is, what community capitals are present? What relationship is there between the level of a specific capital and the way community members talk about the capital? And what gaps remain between descriptions of social and other capitals by community members with the results of the CDSI, as well as their holistic descriptions of the community through qualitative interviews? So the context of the project, as I said, was this project Healthier Together Georgia, part of the CDC High Obesity Program in partnership with University of Georgia, as well as community coalitions made up of formal and non-formal leaders in the community. These community coalitions are in charge of on-the-ground decision-making and certain allocation of funding for project development. This methodology was an embedded mixed method design in which the quantitative portion was embedded in an overall qualitative study. So big qual, small quant, and the purpose was complementary, or to triangulate the results of a qualitative study to see to the extent of which their qualitative descriptions of community were congruent with their quantitative assessment. So the qualitative data collection was semi-structured interviews with the coalition members. Out of 25 contacted, we interviewed 12, and the quantitative data collection was the CDSI Community Agency Survey, immediately following the interview with the coalition member. And these were developed as Likert type scales for each capital. So I'm going to talk a bit about the results looking at each capital. So over on the left-hand side, we can see the quantitative results, and that the majority of participants disagreed that human capitals were a strength in their community. We can see from the qualitative interview data that participants discussed health issues, lack of access to health care, food, and other critical resources that would help them spiral up this capital in the future. But Healthier Together Lambert, to the March 21 date, had provided some improvements. So in the middle, you can see some representative quotations for each capital. Angela here is talking about losing the hospital and now having the closest ER that is 25 minutes away. Social capital was actually the strongest capital agreed upon by participants in the CDSI section. They thought it was a very big strength in their community, and this was represented in the qualitative results as well. It was the most prominent capital discussed by all coalition members, and we can see here that Marvin, who actually choked up during this part of the interview, talking about not being from that community originally, they have been the most loving, caring group of people who just want to see their community blossom. Cultural capital, this was one that participants disagreed was a strength in their community. The biggest cultural capital present in the interviews was primarily religion. This was a Protestant Christian community that was a big part of the cultural ethic and the heritage. It also had a strong agricultural heritage, but several participating coalition members discussed limited inclusion of multiple groups in the community, specifically minoritized groups. We can see here Jackie discussing it was one of the hardest places to bring in inequality, and Angela discussing the pride of their agricultural heritage. Sorry. So participants were fairly neutral in how they rated political capital in their community based on the real limits of the scale. A lot of participants talked about how it was a strength that they had both elected and unelected officials participating in their meetings. You can see here council members, the mayor, city commissioners, and even one state representative, but that there were significant bureaucratic barriers to program development and momentum moving forward. Natural capital was also neutrally perceived within the CDSI Toolkit. Over in the qualitative sections, we saw participants describing a presence of natural capitals, but the community had experienced several significant natural disasters over the last decade that complexified and made some of the healthcare and resource challenges that they experienced more significant. We can see Marvin here discussing some of their natural capitals, like the lake, having the cleanest water and air in the country, but those strengths not being valued by community leaders to leverage those natural capital points to increase physical activity opportunities for people to get out and be in nature. And finally, we have built financial capital. So again, participants were fairly neutral in their assessment of this capital as a strength, but in the qualitative results, we actually saw a fairly negative perception of built financial capitals in the community. There was a lot of lack of access to resources for improving the economic development and economic opportunities in the community. And here Angela discusses a significant event of job loss in the community 25 years ago when their sewing factories were outsourced and multiple folks, about 500 people, actually lost their jobs in the county. So qualitative participants described how people would have to travel, most likely an hour, 30 minutes to an hour just to get to work every day. So people living in the community were not necessarily working in the community or gaining economic prosperity in that community. So that was a lot of results. So here's a table. So here we have the ratings of the capitals perceived in Lamb County. Up top we have the CDSI mean averages. So we see that social capital was the highest rated capital, which was highly congruent with the qualitative results. We see that human capital was rated the lowest. Again, congruent with our qualitative results about lack of health care and issues of access. We also see political as rated fairly highly, where people were positively perceiving the participation by elected officials. Built financial, followed by natural, and then followed by cultural as second to last. But if you look here, built financial contains the most significant dissonance between the quantitative and qualitative results. It was rated fairly neutrally within the real limits of the scale, but in the qualitative results, we heard multiple times, job loss, lack of access to resources, no opportunities for youth to get jobs and to prosper in the county moving forward. So looking at it from the qualitative and quantitative perspectives, we can see where this dissonance happens, and it can help inform us for project development moving forward, rather than just using a quantitative or qualitative scale alone. So some key findings were that mostly the qualitative and quantitative findings of the CDSI plus the community capitals analysis were mostly congruent. They supported each other most of the time, save for sometimes within political capital, where it was rated neutrally, but actually participants were quite proud of the participation by community officials, as well as built financial, which contained the biggest divergence. The human capital was rated the lowest, both in the qualitative and quantitative findings, which was not surprising since this is primarily a food insecurity project. There are some limitations to the current study. The participants themselves may not be representative of the community as a whole, because to be part of the community coalition, they're actually self-appointed. They may be sought out by some of the extension agents in partnership with UGA, but that itself can be a fairly limited and homogeneous group of recruitment. So the community perceptions here can only be described as a case within the coalition members themselves. Additionally, COVID-19 limited our ability to conduct a broad community survey. We were going to do the CDSI community agency scale to the entire county, but we ended up having to tweak that a little bit and just provide the survey to those that we interviewed. There are several implications from this study though. When working in rural communities, primarily in the South, social capital is one of the most important aspects in rural communities. So we have to find ways to leverage that in order to spiral up the other capitals. The CDSI can identify both strengths and gaps, and using it in a mixed method way can help us really find the nuance in where those gaps are. It also helped us demonstrate the impact of our project, Healthier Together Lambert. And in the future, we plan to conduct both pre, which we've done, and post assessments of community capitals to leverage these resources in the community, as well as moving forward, respecting the pride that the community has for themselves as a source of change. Thank you so much for listening. I appreciate your time, and I did just want to provide a quick link. Dr. Boron is doing a postdoc position to work with the CDSI Toolkit. So here's a link to that position there, as well as her email if you have further questions. presentation. Do we have any questions for her?
I love this, and so I want to know more about the CD+SI. Is that something that's widely available that others can use? Is it something that you have to pay and have a certain kind of, expert ability to facilitate? Tell us about that.
So at this point, and you can correct me if I'm wrong, I don't believe that there is any cost associated with using the toolkit. And there's a lot of resources online through both UG Extension as well as Dr. Boran's publications and Dr. Lamm's publications about how to use it. I just discussed the community agency aspect, but there's also a personal agency aspect of the CDSI. And I know that Dr. Boran is going to discuss shortly about using those in tandem. So at this point, I think it's widely accessible. With a bit of reading, it's quite easy to conduct a mixed method study.
Thank you.
I think I saw a hand back there. Yeah.
Yeah. What do you think you found out the difference between the quantitative and qualitative results in a single aspect and in all of the instruments?
So why do I think that there was a difference?
Yeah.
We talked about this, and sometimes when you're taking a survey, you may have a bit of a response bias. So while in the qualitative interviews, there was a lot of negativity about the built financial capital, it was also over the phone. So I was essentially an abstract voice talking to them about their community. So there may have been a sense of being a bit more honest with me there. But when you're putting down numbers, sometimes people think that might be a bit more permanent and could affect any sort of funding coming through the line. So that's just a guess, but that could be a reason why there was some divergence there. We also didn't specifically ask, looking at the items in the built financial construct, we didn't place the interview about those constructs specifically. It was a bit more emergent in how they discussed it. So if we had done it to ask about the specific items within that construct, it could be a bit more congruent.
Thank you.
Any other questions? All right. Thank you very much. Thank you so much. Thank you.